Good morning, ladies. Caitlin here. It is first thing in the morning, so please excuse my looks. I just wanted to give you guys a quick update because I know that if I put all of this in my 27-week video tomorrow, that it would be super long. So I had my doctor's appointment this past Tuesday, and as most of you know, they did my glucose test, and they said, we will call you back the next day with the results of that, just keep you updated on everything. Milo, stop. So they gave me a call back the next day. If some of you don't know how the glucose test works, they give you the, sorry, my dogs are being noisy. They give you the Glucerna, or not Glucerna, but the glucose drink. It's probably about that tall. And I got the orange kind. I don't know what other kinds you can choose from. I just said orange because that's what I heard tasted the best. So I got that, and you're supposed to drink it a half an hour before your appointment time starts in case you have to wait in the lobby, for a half an hour or so. Well, if some of you guys don't know, I had an ultrasound that day too, and Grayson was not cooperating. She was facing my back. She was head down, facing my spine, and we couldn't even get a profile shot. We couldn't see any of her profile at all. So, but off of that subject, but she's doing good otherwise. She was just being silly. But they called me back after, the next day with my glucose results, and she said, Caitlin, your results were so high that we're actually going to just skip the 3-hour glucose test. We usually do a 1 hour, and then if it's a little bit high, we go ahead and we do a 3-hour to check it out. And I don't know, I'm frustrated. She said, so we're just going to categorize you as having gestational diabetes. And I said, so we're not even going to do the 3-hour test. And she said, no. And I asked what my result was. And if none of you are, I don't know who's in nursing in this community, but the normal glucose level is 80 to 120, and then like 140 to 150 below is good. It's not considered, like, you don't have to have any insulin. And oh, I look terrible. But she said we're just gonna skip, the 3-hour test and go straight into putting you into that category. So I need to meet with you right away to do to set everything up, get you the AccuCheck, all of my test strip, prescription, and my Lancets and everything. So I am now going to be checking my blood levels, or my sugar levels, 4 times a day. I have to do it right when I wake up in the morning. That's considered my fasting sugar. I have to do it 2 hours after lunch, 2 hours after dinner, and then right before bedtime. They called me with this on, let me think, they called me on Thursday because they actually called me a day late. They called me on Thursday with the results. I don't even think I told you the results. They were 231, which is insane. That's very, very high. I would be giving my patient insulin right now. I would be giving them 4 units of insulin, depending on their sliding scale right now, if that was them. So that's very scary. Diabetes runs in my family, so I'm kind of curious if I do have it, because my whole life, ever since I was a toddler, I think I mentioned this in my last video, I've had fainting spells. And they've never really done a big workup on it, and who knows, I may be diabetic and may not be just gestational diabetes. So my sugar results were 231 for their test. Ever since I got my AccuCheck machine, which was on Friday, my sugar levels have been well below 200. They haven't been, higher than that at all. The highest reading that I've had, which I had to, cheat a little bit, because we didn't have any good groceries in the house yet. Good enough, like diabetic type groceries. My highest reading was 168. So if I got that reading from one of my patients, I would be giving 2 units of insulin on a regular sliding scale. So that was my highest reading. Other than that, they've been, pretty good. Joe and I, we went and got some good groceries, low fat, low sugar, everything. He's really supporting me on all of this, and hopefully this is gestational. I can't even talk. Gestational. And I'm hoping and praying that I won't have to do this for the rest of my life, and that I can just control it with diet and not even have to worry about checking my sugar. So who knows? I'm not going to let it get me down. I just cried and cried and cried the first night that I found out, just because I was so stressed out about it. Just one more thing. It seems like nothing can just go. Lily, stop. It just seems nothing can go easy in this pregnancy for me. I had the placenta previa. I was on the bed rest. It's just stressful. So, and my iron was also low at my appointment, so I am now on iron supplements. I take ferrous sulfate, which is just iron pills, 325 milligrams once a day. So I take that on top of my prenatal vitamin. I'm still taking extra folic acid, even though you don't necessarily have to. I do anyways. I take prenatal vitamin, extra folic acid. I take my baby aspirin for my clotting disorder that I have, which thankfully I'm not having any issues from that. Baby aspirin, and now the iron. And checking my sugar 4 times a day. So that's my daily routine. If you guys have any questions at all, let me know. They're going to be keeping a really close eye on Grayson and her growth, because gestational diabetic moms tend to have very big babies because of the sugar content, and they're known to be like 10 to 11 pound babies. So they're really going to be monitoring her growth throughout the rest of this pregnancy, because if she gets, too big, they'll probably take her early, because I want to try for a vaginal delivery, and I let them know that. I don't want to just have to be a C-section. So I will update you guys tomorrow. Today is Sunday, and I will update you guys tomorrow before I go into work with my 27-week update, 3rd trimester. So I will talk to you guys tomorrow. If you have any questions, let me know. Bye.